Hi, everybody. This video is about progress note writing. So progress note provides information about what was done in therapy and how the client responded. This serves multiple purposes. First, progress notes serve as evidence of your services to or on behalf of the client. This is helpful for billing purposes. They also convey the client's current progress in treatment, how they're doing. And they provide the necessary clinical details to support medical necessity of each claimed service and its relevance to the treatment plan. Okay. You can think about progress notes as providing answers to the following questions. Why was the service provided? This should be based upon your client treatment plan. If the plan says you're going to help psychoeducate the client on the cognition behavior affect link, this and exactly how you did it should be in your progress note. Next, does it make sense that a mental health provider needed to provide these services? You want to make it known that this service needed to be provided by a therapist. So you would use words like process, assess, model, etc., and provide therapeutic services. You wouldn't write something like, therapist discussed the weather with the client and offered guidance regarding wedding planning. This does not require a therapist and is outside of your scope of practice. Alternatively, you wouldn't solely rely on behavioral interventions like coaching on coping skills, which a rehab specialist could do. If so, the biller might ask, or sorry, the insurance company might ask, why are we paying a therapist the rate of a therapist for a rehab specialist's job and rating? So you want to include therapeutic processes in your progress notes. Next, what intervention towards the mental health need was provided? What exactly did you do in the session? And then finally, does the service provided address a current goal? Meaning that your intervention should be targeting one of the goals you identified, and this link should be clear. If the goal is to reduce aggressive behaviors and your intervention is activity scheduling, this makes no sense and could be seen as not treating the client's issues. So you would make it clear that you're introducing something like deep breathing to help the client utilize this as a relaxation strategy when upset. And that makes it clear. Okay. Requirements. At the very minimum, in order to be consistent with ethical standards and standard of care, progress notes should include all of this information somewhere. If you are using an electronic chart, the first 4 things listed here are provided using drop-down menus. The date of service is the date that you met with the client. The date, that's simple. The service intervention or service code is a billing code, and you'll learn about this from your agency. The location is where you met with the client. Was it in the office, the client's home, their school, etc.? Time spent with the client is the amount of time you did therapy with the client, your face-to-face therapy session. This is written in minutes and is typically about 60 minutes. The next 4 things are in your actual note, and I'll go over them in more detail next. And then the last thing is your signature, which is obvious. So the structure of a progress note for DMH contracted sites and many other sites uses the GURP format for note writing. This ensures that you get all 4 of those components that I mentioned in the previous slide. G stands for goal, I stands for intervention, R for client response, and P for plan. More detail next. First is the goal. This is the easiest part of the progress note because you're essentially plugging in the goal you created in the treatment plan. If you don't remember how to write goals for treatment planning, go back to the treatment plan video where we went over SMART goals. If you have more than 1 goal for the client, which you likely do, you would select the goal that was most directly assessed in this particular session. Underneath the goal, you would write briefly about the client's progress toward the goal. Has it been met, not met, partially met, and so on. So you can see below that I have written my goal, which you may remember from the treatment planning video, decrease panic attacks, explaining what those are, from 7 times a week to 4 times per week in the next 12 weeks. And right below that, I have written goal not met. The intervention is the bulk of your note because it describes what you, the therapist, did in the session. And it serves to justify the amount of time that you're billing for. For a 60-minute note, you're normally writing between 4 and 6 sentences. The intervention section is normally written in past tense third person, describing exactly what happened in session. You can write it in narrative format or in bullet point format, if you prefer, so long as your agency allows that. It should directly address the goal for the session and utilize interventions described in the treatment plan, making everything consistent. So here's an example. Recall that these were the 3 things I wrote in the clinician's role in my treatment plan, listed here: providing psychoeducation, exploring panic and anxiety triggers, and modeling anxiety-reducing techniques. I have highlighted a few things in my intervention write-up. First, I indicate which goal I'm working on. Therapist met with client to work on reducing panic attacks. Okay? Then I share the intervention that is consistent with the treatment plan and follow up with more detail. So I'm providing psychoeducation, which is consistent with number 1 in my clinician's role, and then I'm explaining in more detail. Anxious thoughts trigger anxious emotions and worry, which then elicit physiological response of a panic attack. Then I introduce the thought journal, which is part of the client's role in the treatment plan, which you may remember. Okay, so there's thought journal highlighted there. And I follow up with a homework assignment to practice monitoring and tracking triggers, which is something the client had agreed to in their role, and also something that the parent had agreed to in the support member's role. So here's a second example of how I would write that exact same session up using bullet points. So you'll see that I've made only minor modifications to remove some of the transitional things that are included in the narrative, but still include all of the relevant information about the session that shows that it's linking between what the goal is, what I said my role was going to be, and what the client said they were going to do. So either the narrative or the bullet points would be satisfactory so long as they provide enough detail and make the intervention and the content of the session clear. I would say that the intervention is the most important part of the session because it shows what you did and it justifies the amount that you're billing. All right, once you've written the intervention, the next part is the response section, which indicates what the client did in session and how they responded to your intervention. This too can be written in narrative or bullet point format, and potential sentence starters are provided here. You'll want to make sure that the response section is consistent with what you said you did in the intervention section. So if you said you worked on coping skills in your intervention, explain how the client did with practicing these coping skills in their response section. If you said in the client intervention that you worked on practicing coping skills and the response is all about how the client talked about fighting with their sister, that doesn't make any sense. So here's an example. And I want you to notice how the client's response makes sense given what I wrote in the intervention. So I'm going to read it. Client demonstrated engagement throughout the session and was interested in understanding her panic attacks better, showing that it's clear that I'm working on panic attacks. Client demonstrated active listening while therapist explained the cognition affect behavior link and was able to explain this link in her own words and begin to identify some of the thoughts she experiences shortly before having a panic attack. So remember I said I was going to provide psychoeducation about the cognition affect behavior link, and I explained exactly what that was going to be. So here I'm saying that the client listened to that, and I'm saying that they understood. And the way that I know they understood is because the client was able to put it in her own words. Next, the triggering thoughts included, I will never get this done and I'm destined to fail. Okay, remember I said we were going to look at the specific anxiety triggers, so the client has named these now. Client appeared unsure of her ability to interrupt negative thoughts and stated that she has never been successful at this in the past because her thoughts are too powerful. This is useful information to have and is relevant given what was discussed. Client was open to creating a thought journal and was able to work with therapists to create it. Remember I said we were going to create a thought journal. Client wrote the anxiety-provoking thoughts she had identified into the journal, which shows that I'm practicing with her, showing her how to do it. And then client agreed to practice using the thought journal and bring it into next session. This is the homework assignment I said I introduced and her response. Okay. The last part of the progress note is the plan, and it is a two-part section. First, you indicate what you, the therapist, will do to support the client, and then you indicate what the client will do between now and the next session. All right, so I've written, therapist will continue to work with client on identifying anxiety-provoking thoughts and interrupting them with positive self-talk. And client will track anxiety-provoking thoughts using thought journal and bring to next session. This is the end of the GURP note, and this is what will be used for a regular therapy session, okay? And it would include each of these parts. Now, for assessment and treatment planning notes, you're not technically using the GURP format because you've not yet developed your treatment goals at that point. Instead, you would write narrative or non-GURP notes. Though they're non-GURP notes, you can still think of them in a sense of being very similar. You can kind of think of them as being IRP notes because they're including everything, the intervention, response, and plan, except the goal. Okay, so they're IRP notes. In the assessment note, you should indicate that you went over informed consent and limits of confidentiality. So you'll see I wrote therapist discussed informed consent and limits of confidentiality with client demonstrated understanding and signed informed consent document. Okay. You also want to include which specific sections of the assessment you completed. Okay, so I wrote therapist completed mental health history and mental status exam. This is helpful because you'll have likely 3 or 4 assessment notes, and this shows whoever is looking at your notes what you spent your time doing in the assessment. So it helps to make it clear exactly what you accomplished in that assessment and what's left to be done. And this is good because it makes it so that you don't look like you're just assessing forever with no main real purpose. You also want to include key information that you gathered during this point of the assessment, so anything that stood out. So I wrote client shared that she struggled with PTSD ever since being mugged. And then you want to include your plan for completing the assessment. So what are you going to do next? If it's your final one, then you would write something like therapist will meet with client to create treatment plan. But if you're still assessing, what exactly are you going to complete next? So I wrote therapist will meet with client next week to complete psychosocial history. Now, this doesn't mean that this note is 4 sentences like I have here, or 5. You would add more detail, but these are the essential things to include, and you would fill in the rest. Okay. I would say that an assessment note is probably somewhere around 6 to 8 sentences. Okay, a treatment planning note is very similar to what you do in an assessment, but what you're including is a little bit different. In this note, you want to include somewhere in there that the treatment plan was collaborative. That's really important. So I wrote therapist and client collaborated in the development of treatment goals. So there's something you write. You should also describe the goals that were created. So don't just write goals were created, write what they are. Client's first short-term goal was reduce panic attacks, blah, 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 blah. Okay. And then the plan for the treatment of these goals. This could include some of your interventions and some of what the client says they would do in the client's role. And so it could start off with, in order to work toward these goals, therapist will, and then explain, and then client will, and explain. And then your plan is going to include, are you having another treatment planning session, or are you starting up with treatment next? Okay. All right, so although GURP is the most widely used format for progress note writing, there are other formats, and your agency may use something different. And so this one here is BURP. Okay, so this is a different format, but it's very similar. So all that's changed here is that the goal has been integrated into the intervention section. So you'll see in intervention, it says what goals and objectives were addressed and was homework reviewed. Okay, and it's added B, behavior. And in the behavior section, you're providing subjective and objective data about the client based on your observation and the client's statement. Okay, those are the only differences. Another format is SOAP. And here, S and O take the place of B, behavior, from the BURP section. So the subjective and objective information would be separated out here. And then in A, assessment, you're providing an assessment of the client's overall functioning, which can be sort of thought of as like a progress towards goals and response to session section. And then you end with a plan. And then finally, there's DAP, which is very similar to SOAP, except it adds specific detail about the session, what was done and how it went. So you see it has in the data section, your subjective and objective, just like the BURP and SOAP method. And then it adds the content and process of session, which can be thought of as the intervention section in a GURP note. Okay. It has the assessment like it did in SOAP, and then the plan. Okay. So just so that you're familiar, in case your agency wants you to use these other methods, they'll train you on them, but at least you have some familiarity of what they are. So please note that when you're doing your mock client progress notes, I want them to be written in GURP format, since this is what you'll most likely end up doing at your practicum site. So make sure to use the GURP format, goal intervention response plan, for the progress note that you write. Your assessment and your treatment planning note will be written in narrative format, as I explained in this video. Okay, so that's it for progress note writing. Let me know if you need clarification on anything or you have any questions, and thank you for listening.